Did you know that knee osteoarthritis is on the rise globally, especially in women after menopause? Today, we're diving into scientifically backed supplements and medications that can help with that knee pain,
including protein powders for your coffee and topical treatments as well.
But remember, no single treatment fits everyone perfectly. I'm Dr. Banasali with Plant Forward MD. Let's dive in. One of the most common questions I get are supplements. What can I take that's in a pill bottle or otherwise that can help my knee pain feel better? First up is omega-3 supplementation. Omega-3 fatty acids that are found in fish, as well as some plant sources, can reduce the production of prostaglandins and inflammatory cytokines. And they can also balance that omega-6 to omega-3 ratio, because in Western diets, there's often way more omega-6. But here's a myth, that all omega-6 are bad. They are not. They are essential to our diet. We just want to have a better ratio. We want more omega-3s to omega-6 because that's what supports joint health. Studies show improvement in joint stiffness, pain scores, and morning discomfort when you have consistent use of them. And if you can't handle fish oil supplements or you don't want to take them, consider using flaxseed or chia seeds because they also have a lot of omega-3. Let's move on to curcumin, which is the active part of turmeric. You can take it as a capsule, an extract, or even in your food. Curcumin, the active part, is what blocks the inflammation pathway, which is associated with cartilage breakdown, which you don't want. Clinical trials showed that osteoarthritic pain was reduced with curcumin supplements, and it improved mobility, which is really what we want. We want people to be able to move. And some of the studies found that the results were comparable to NSAIDs, anti-inflammatories, and that curcumin had better GI outcomes, like less bloating and gas, which we don't want. Practical tip is to choose supplements that have piperine or black pepper in them because that helps the absorption. There are other supplements that don't have quite as much data, positive data behind them, but there is some. First one being Boswelia, Boswelia serrata. This is a herb that contains a special compound that can reduce inflammation. And there was a meta-analysis that supported it for reducing pain and improving function in osteoarthritis. What about collagen peptides? That I feel is the newest buzzword and something I'm getting asked a lot about.
So many people are putting these protein powders in their coffee. Do they actually help? And what does it do for knee pain?
Collagen peptides may stimulate cartilage production and improve joint integrity. A meta-analysis did show improvements in joint pain and mobility. However, the studies that it was looking at were pretty small. And when you have small studies, they could be very variable, different populations. So we definitely need larger scale studies for that one. And then there's SAMe, S-A-M-E, S-adenosylmethionine. Yeah, it's a mouthful. And it's thought to reduce inflammation and improve the function of your joints through methylation and neurotransmitter modulation. All this to say that some studies showed that it was comparable to NSAIDs, those anti-inflammatories, but with a slower onset and fewer side effects. But the research on this one is really mixed. Some studies support its use and some studies were saying, no, it's very inconsistent and didn't quite work as well as we thought it would. Again, we need bigger trials for this one. Remember, supplements are not regulated, and when you're taking something in pill form, it can interact with other pills, other medications you're taking, and it can be more impactful on the body as opposed to when you're taking something in your diet. So if any of you know me, then you know that I'm all about food in your diet as much as possible before moving on to other pill type supplementation, unless you really need it. Let's move on to vitamin D, which you may have heard a lot about because there are so many studies on it for so many different conditions. Low vitamin D levels are common in people with osteoarthritis and have been linked to worse symptoms. Supplementing can help if you're deficient in them, but if you're at already normal levels, it may not really help so much. Data is still a little bit inconclusive on it. If your levels are low and you wanted to try it, that would be fine. But I have had some patients that are taking way too much, like in the toxic level range, and that I would most definitely not recommend. More does not necessarily equal curing your knee pain. A question I get several times a month is, what about glucosamine and chondroitin sulfate? These are pretty widely used for joint health. If you look at a lot of the pill bottles that say arthritis relief, they'll have this in them. But the evidence is very mixed. Some people do report pain relief, and if it's really helping you, then the side effects are fairly minimum, and it may be okay to continue depending on your other conditions. The large-scale trials, though, are showing minimal benefit. There is a version in Europe that is more concentrated and slightly different than the ones that are in America, and those have shown to perhaps have some benefit to them. If you're going to try it, you probably need about 2 to 3 months to try it. And after that, if you don't see an effect, it may not be worth spending the money in your wallet. And last on our list is MSM, methyl sulfonylmethane, another mouthful. This is a sulfur-containing compound that could reduce oxidative stress and inflammation, which is what we want. But in the studies, and they were tiny, there was modest pain reduction. But we do need more studies to confirm whether it really is effective in osteoarthritis. And if you wanted to try medications but that were not pill form and rather more of a topical form, because whenever something is topical, we think of it usually as having less absorption. Not all medications, but some of them. You could try NSAID gels, and these are NSAID formulations, anti-inflammatories. However, they tend to not be absorbed as much as pill form. You can use diclofenac gel, and that can really help with knee pain in a lot of different people. You often need to apply it regularly though to maintain that pain relief. And remember, you don't want it absorbing anywhere else in the body. So if you're going to rub it onto your knee, then you want to make sure that you wash your hands otherwise, because we don't want it anywhere else. If you have kidney disease or sensitive skin that's kind of prone to irritation, you may not want to use this. The kidney disease is a caveat though. There are some people that are able to take it depending on the level of disease. A good idea to ask your healthcare team first. What about the chili pepper cream, capsaicin cream? These are from the chili pepper, just like it sounds like, and they can reduce substance P, which is a pain messenger to your nerves. Again, this needs kind of regular use to see the benefit, because the first few times that you apply it, you're probably going to feel more of the burning sensation and not the pain relief. But kind of as you keep doing it, that's when you start getting relief from the pain. Be really careful with it, because yes, it can burn your eyes, so don't rub your eyes with it afterwards. Make sure you wash your hands and only apply to the area that's needed. Especially if you have sensitive skin or eczema even, this can be a little bit tough for you. So when you have knee osteoarthritis, this means that you kind of need your own toolbox of different options that you can use at different times. Start by kind of the dietary choices, which I've showed in a different video. You can discuss supplements and some of the topicals with your healthcare team. And there are emerging medications that can be potentially helpful in some people with knee osteoarthritis, as well as other interventions that I've done a video on before, like GLP-1 medications, PRP injections, genicular nerve ablation, and embolization. But if you're looking less at injections and more on supplements, because you do need to move, that is one of the most important things that we find for most of our conditions, any kind of musculoskeletal condition. It really does better with movement. And if you have a lot of pain, you're not going to move. I hope this video helped. Please share with somebody else you think might benefit from it. I'm Dr. B with Plant Forward MD. See you next time for more health tips.